America is awash in medical debt. Some 100 million people owe a combined $220 billion in unpaid bills. This kind of debt can delay people's access to medical care, harm their mental health, even send them into bankruptcy. So when a nonprofit popularized a cheap, easy way to help by buying up debt for pennies on the dollar and forgiving it, lots of folks jumped on board.
Today, I am so proud to announce that we are taking steps to retire medical debt for up to an estimated 1 million Arizonans.
This is a $12 million proposal that would eliminate $1 billion in medical debt for Cook County residents.
It seems the least we can do with this debt that I cannot fucking believe we are allowed to own is to give it away. So are you ready to do this?
Cities, states, and regular people are spending millions of dollars on these relief efforts. But a new study throws a big bucket of cold water on the benefits of this approach. Today, what researchers found and where experts say we should go from here. From the studio at the Leonard Davis Institute at the University of Pennsylvania, I'm Dan Gorenstein. This is Tradeoffs. For years, Dr. Henry Harrell felt like he was part of this problem.
Frankly, there's a lot of people that have been put into medical debt by me and my practice.
Henry's had a primary care office in downtown Nashville for the last 27 years, and dealing with patients behind on their bills has always been one of the harder parts of the job.
I will get a quarterly report from our office that says, here are the patients that still owe you and will be put out to collections, and who do you want to be put out to collections, and who do you want to dismiss from your practice?
On the whole, Henry says he errs on the side of grace, letting debts linger, continuing to care for patients even when they're in the red.
There's not a lot of people that I've dismissed from my practice because of debt and those sorts of things, because there's always been that uncertainty about why. You really don't know the story.
There are times, though, when Henry has known the story, and those stories have given the doctor a deeper understanding of medical debt. How often it's just one part of a bigger, bleaker picture, like a symptom of a more complicated disease.
The patient 3 months ago that was on that report who owed me the most money, I knew that her house had just been destroyed in a tornado a couple of months before that. And so you realize that there's other stories that you need to factor in. And what would that feel like to suddenly be put out to collections and lose your doctor and you don't have a home?
So when Henry first heard several months back about churches raising money to forgive their neighbors' medical debt, he thought, this is my chance to be part of the solution. And he figured it'd be a pretty easy sell.
Nashville is kind of a big healthcare community, so a lot of my church is in the medical care field, either as physicians or as nurses or as healthcare administrators. And so I anticipated that it would be something that would really resonate with a lot of people.
Their church, West End United Methodist, is less than a mile away from 4 major hospitals, including the largest in the state, Vanderbilt University Medical Center. And Henry was right. Lots of folks were eager to repair harm they felt that they had in some way done, even if indirectly, to their own community. They got even more excited when Henry told them that for every dollar donated, the debt relief charity that they were working with, known at the time as RIP Medical Debt, could buy and forgive up to $100 worth of debt.
To tell people, we raised $10,000, that's $1 million of medical debt. That kind of blows people's minds.
$10,000. That was the goal Henry set this March for his church as a part of a service project tied to Lent. He announced it with a short blurb in the church's Monday newsletter, with plans to pitch it in earnest at that week's Sunday service.
That came out the Monday before, and by Tuesday, we had already raised $10,000.
In just 24 hours. So Henry raised the bar to $25,000. The group cleared that too. To date, the church has raised $83,000, enough to clear $8.3 million of medical debt. That would forgive all of the eligible debt in their county and lots more counties across the state of Tennessee. For the rest of March, Henry rode the high of a job well done. Then he got a text.
It was Tuesday the 9th at 9:45 a.m.
A message from a woman at Henry's church who had helped with the fundraising.
She just sent me the link to the paper. And because the tag on the article just says the effects of medical debt relief evidence from 2 randomized, and then it's ...
Henry, busy with his clinic, started searching online for a quick recap.
And I saw the Sarah Cliff article in the New York Times.
The story explained that researchers had followed more than 200,000 people, randomly forgave the medical debt of some, but not others, then compared the two groups. Roughly 2 years later, little had changed. The top line finding, forgiving medical debt had failed to improve most people's mental health or their ability to access medical care, 2 of the 3 main measures the researchers had set out to study. The third, and most counterintuitive, people's financial health, that didn't improve either. In part because, just like Henry's patient whose house had got hit by the tornado, erasing one medical bill does little for people who tend to have a bunch of other financial problems at the same time. And also because after recent policy changes, most medical debt no longer counts against people's credit scores. The doctor felt like he'd been punched in the gut.
Then you're just like, well, this can't be real.
As he started spiraling quickly through the 5 stages of grief. First, denial.
Who's this article coming from? So that's the first stage. It's like, who are these people really? You know, what do they know? Oh, well, it's from Harvard and Stanford. Okay, well, they're pretty good.
Next, anger. Without much thought, Henry fired off a feisty tweet, tagging 2 of the paper's authors.
Okay, for the record, at Neale Mahoney, at Ray Kludner, I'm mad at you. Not the most mature response, but imagine being a physician who last month led your church on a at RIP medical debt campaign that wildly exceeded all expectations, and then someone says, "Seen this? That's me."
Pretty quickly, though, Henry says he reached the 5th and final stage of his grief, acceptance.
When I calmed down and, really thought about this is important to know. You know, I've been in the practice of medicine 27 years, and there's so many things that make sense that turn out not to be true. And so I see the importance of understanding what is the true effect of these things.
Henry still feels good about the fundraising campaign he led, but what he wants now, he says, are some answers.
This problem is still there, and the solutions are less clear than we thought. And so what do we do next?
What do we do next? Answers to that from 2 of the country's leading experts on medical debt after the break.
Since 2013, Bombas has donated over 100 million socks, underwear, and T-shirts to those facing homelessness. If we counted those on air, this ad would last over 1,157 days. But if we counted the time it takes to make a donation possible, it would take just a few clicks. Because every time you make a purchase, Bombas donates an item to someone who needs it.
Go to bombas.com/ACAST and use code ACAST for 20% off your first purchase. That's bombas.com/ACAST, code ACAST.
Welcome back. A major new research study has cast a shadow over one of the most popular approaches to addressing America's medical debt crisis. Dr. Henry Harrell is just one of many people this paper has left reeling, wondering what it means for the 100 million Americans still suffering under the weight of unpaid bills. What will bring them meaningful relief? Serious people trying to answer that include the study's co-author, Stanford economist Neale Mahoney, the guy that Henry had fired that angry tweet at.
Responding to people on the internet is not like my MO. That said, I'd been there. I'd been frustrated and disappointed when I first saw these results. It took us a while to sort of figure out, how this evidence, could be used for good.
Another person on this hunt is Allison Sesso, CEO of Undue Medical Debt, formerly RIP Medical Debt, the nonprofit that's forgiven nearly $12 billion of unpaid medical bills and whose work was the subject of Neale's study. It's been hard, Allison says, to reconcile the results with the realities that she says she sees every day.
I know that it does have an impact on people because that's what we're hearing back from people directly. It is meaningful. And I worry that people will take a black and white view of these results and push down what we're doing in a way that is not going to help the larger cause.
That larger cause, finding ways to deliver relief to the millions of people struggling to pay their bills, Neale and Allison have dedicated years of their careers to that, one as a researcher, the other as an innovator on the front lines of this financial crisis. And they both, on their own, have come to similar conclusions about where this disappointing study tells us this work should head next. The first takeaway, relieve people's debt further upstream. That means wipe it away before the collections process can devour someone's savings or destroy their credit. Much of the debt forgiven in the trial was 6 or 7 years old, but Allison says her nonprofit is working to buy younger debt now.
In 2019, 5% of our debt was 0 to 5 years old. By 2023, 67% of our debt is between 0 and 5 years old. So you can see the massive difference.
Neale's study ended too soon to measure the impact of that shift, but he says another paper of his supports the change that Allison has made. That older study looked at a large hospital system's financial assistance program, which reduces or writes off needy patients' bills immediately after a patient's stroke or heart attack.
And we found, comparing those people who barely qualified to those who barely didn't, that people who had sort of the debt relief from hospital financial assistance, they were more likely to go back to the doctor for follow-up care, and they were more likely to get diseases diagnosed and treated.
That's a big impact, says Neale, about the same level of benefit you see when you give people health insurance after being uninsured.
Of course, the benefits of health insurance are long-lived, while the benefits of the financial assistance program we studied only lasted 6 months. But it does speak to the impact of giving people assistance right when they need it.
The big question now, Neale and Allison agree, is how soon is soon enough? Basically, how far downstream from someone's unexpected surgery or unlucky crash does forgiving their unpaid bill still make a difference?
We know that debt relief at the source through financial assistance works. We know that debt relief far downstream doesn't work. It's fairly obvious to me that there's probably a sweet spot in between at the source and further downstream where, we can have meaningful bang for the buck. And I think the challenge for us as researchers and the challenge for advocates is to find that sweet spot.
Takeaway 2. Figure out who benefits most from this work. Neale's study found, for example, that forgiving bills did improve the financial health of the small number of folks who still had medical debt showing up on their credit reports. But a variety of industry reforms over the last decade mean fewer and fewer people are in that camp. So who else could this help?
We are always looking at the numbers and trying to figure out, and not only that, are there, certain communities we should be targeting? Are there certain hospitals we should be targeting?
Allison says her group is constantly experimenting, and in 2022, they opened up their charity to a new pool of people, the middle class.
We've increased our threshold of who qualifies. So it used to be up to 200% of federal poverty, and now it's 400% of federal poverty.
That's about $120,000 a year for a family of 4, up from just $60,000. Research by the think tank Third Way found medical debt actually hits the middle class harder than those with the lowest incomes. Allison says her group is considering other types of studies that might capture the fuller effects of their charity on people's lives. Overall, when it comes to both the who and the how of debt relief, Neale and Allison agree there's a lot to figure out.
We're really still in a learning mode. We're only at our 10-year mark as an institution. These are all questions that we are asking ourselves and are going to continue to examine. I think we have a responsibility to do that.
The third step that could bring people meaningful relief, policy fixes. While forgiving debt, one person, one medical misfortune at a time, can feel good, it's ultimately a piecemeal solution to a systemic problem. The ideal solution, says Neale, is preventative policies that protect people from ending up with unaffordable bills in the first place.
People have unpayable medical bills because they don't have coverage or they have crappy coverage and the price is too high. And so, those things will not be easy to meaningfully change. But I think our study says that those hard things are necessary.
Neale adds that smaller, easier policy fixes can make a big difference, like those recent changes to how credit agencies report medical debt. Allison agrees policy improvements are important and has even added a policy arm to her team. But given that health reforms take time to pass, she says we must continue to bring immediate, even if imperfect, relief.
We are cognizant that what we're doing is not fundamentally solving the problem. We are clear-eyed about that. But we also think people need help today. And so, as we often say, we like to walk and chew gum at the same time. We need both and.
These three takeaways offer some promising steps that advocates and policymakers can take in the wake of an admittedly disappointing study. Allison Sesso worries, though, whether there's the will to take those steps. Her group has spent the last decade bringing attention to this issue, building political momentum, relieving nearly $12 billion of medical debt relief for about 7.5 million people. But a stream of media stories since the study came out have boiled down that work to phrases like, quote, little impact and no benefit.
I worry that when you put out results like this without the right context and you try to have these debates within just the media, it undermines what you should be taking away from it and some of the nuance that's behind what's being done.
Allison says she's committed to deepening her group's policy work, buying younger debt, and partnering with hospitals to improve financial assistance programs. All things Neale agrees his study affirms are on the right track.
Allison and her team did the brave thing of studying the impacts of medical debt relief. It would have been very easy to dismiss or to deny the results. But instead, I think they've thought about them deeply and are thinking about how they can address these problems in more impactful ways.
As for Dr. Henry Harrell in Tennessee, this study has taught him relieving people's medical debt, a problem he's inflicted on some of his own patients, is harder to solve than he and his church had hoped.
I think that ultimately the debt forgiveness is something that we could easily do, and we did. And it's a very merciful thing to do. But part of the inspiration for it was I wanted to start the conversation about the problems with our healthcare system, the inequities that are in it, the people who are going without.
The lesson Henry says he's taking from all of this, he's just gotta have to work a little harder to help tackle a crisis that derails the health and dreams of millions of people.
So I think in many ways, this is just the beginning of the conversation and hopefully the start of our work.
I'm Dan Gorenstein. This is Tradeoffs.
The mamas, bonus moms, office moms, moms of moms. This Mother's Day, give back to the ones that have given us so much. 1-800-Flowers helps you celebrate all your amazing moms with handmade bouquets, sweet treats, gourmet food, and one-of-a-kind gifts. Ordered easily and delivered fresh. For a limited time, you can save up to 40% off Mother's Day bestsellers at 1-800-Flowers.com/ACAST. Don't wait. Order today and save up to 40% at 1-800-Flowers.com/ACAST.